Good afternoon. My name is Courtney Schemp, and my nursing colleagues, Lauren Duggar, Megan Freeman, and I will be speaking with you today about the importance of fostering nursing within healthcare institutions. Our objectives for this presentation include the following. What is considered a nursing institution? Why should healthcare organizations consider their facility a nursing institution? This will be supported by the fact that nurses are innovators, nurses collaborate, and nurses save lives and money. Lastly, what can healthcare administration do to foster nursing within their own organization? What is considered a nursing institution? Quite simply, a nursing institution can be considered anywhere a nurse works and practices. Nurses are the most influential and important components of the healthcare workforce. To begin, the contributions made by nurses are as significant as they are numerous. Nurses conduct groundbreaking research, leading to new treatment modalities. Additionally, they are innovators who find new ways to care for patients and improve the healthcare system as a whole. One example of how nurse-led research impacted the healthcare field would be how the Nurses' Health Study, or NHS, researched type 2 diabetes over several decades. Their study concluded that obesity was the strongest risk factor for development of the disease, leading to the recommendation that maintaining a healthy body weight would be the most effective way to prevent type 2 diabetes. This nurse-led research helped shape and guide treatment for this epidemic, thus contributing greatly to the fields of science, medicine, and public health. Nurses have been known for having a unique ability to devise practical, safe ways to care for patients. Now, you've probably noticed the picture here on this slide, and while it may be intended in part for humor, it in fact shows remarkable innovation to reduce falls and promote patient safety and comfort during a procedure. Some nursing innovations you may already be familiar with are the Billy Bonnet and the Aquabox. Both have been used in hospitals nationwide. As technology advances, though, so do treatments, and therefore so do the contributions of nurses. Recently, for example, nursing students partnered with engineering students at Duke University to develop a telerobotic nursing assistant to care for Ebola patients. This not only allows for the nurses to prevent becoming infected themselves, but also reduces the infection risk of passing the disease from one patient to another.
Nurses are fundamental within all healthcare settings. Nurses do not come to work to follow a physician's orders blindly. Instead, the nurse's assessment, intuition, skill, and knowledgeable caring all come together in their practice to best support each patient and that patient's specific needs. Nurses are vital members of the healthcare team that supports each patient within their healthcare organization. Nurses are essential team members whose knowledge, skill, and expertise are invaluable. Nurses are teachers. They teach other nurses as well as their patients and caregivers. Nurses also teach new physicians as they learn to feel comfortable in their new roles. Several studies have shown that newly qualified physicians' early development and socialization within healthcare settings is informed by their working relationships with nurses. It is also the nurse who liaises between departments and specialties and communicates changes in condition. Ultimately, it is the nurse who is frequently leading the patient's care. One physician commented in Burford's article, "Nurses are the ones that you actually go to when you're in trouble and don't know what's going on, because they tend to know more than anyone else." Effective collaboration between physicians and nurses impact patient outcomes. In a grounded theory study completed by Lori Fuster-Thuente, she described how effective communication between physicians and nurses reduces med errors and costs to medical institutions. Additionally, CMS scores improve. CMS scores influence hospital reimbursement, and better scores lead to greater funding, as well as favorable results on Healthcare Compare websites and government oversight reports. It has also been noted that when a physician-nurse duo present with a hierarchical relationship as opposed to a relationship based on collaboration, there are often ramifications. Patient outcomes suffer, nurses report dissatisfaction with their job, and healthcare organizations are weakened. When interactive and interdisciplinary patient rounds are the norm, all voices and perspectives are considered and valued. It has been recommended by Streeton and her colleagues that multidisciplinary committees, or MDCs, should be formed in healthcare settings to better facilitate communication between all providers. MDCs promote a culture of safety for patients and healthcare members. It has also been noted that nurses who work closely with physicians and participate in shared decision-making tend to experience less burnout and greater job satisfaction.
Nurses save money and lives. Studies have shown that quality nursing can not only save money for hospitals, but create better outcomes for patients and decrease mortality rates. So how does quality nursing save money? A 2016 study showed magnet recognition, or hospitals recognized for nursing excellence, predicts better total performance scores. Medicare reimbursement can equate to millions of dollars for hospitals, and the study suggests that investment in quality nursing may be offset, at least in part, by better performance on value-based purchasing measures that make up total performance scores. As the study offers, these findings are of interest to hospital administrators as they look to navigate a system that rewards high-value care. However, nurses are not just dollar signs, and their value lies more in how they impact patients and the patient experience within the hospital. Better patient outcomes have been linked to quality nursing, which comes from better nursing education and better working environments. A 2016 study within the Journal of the American Medical Association Surgery found that better nursing environments are associated with lower mortality rates. Clear numbers from a meta-analysis show how quality nursing impacts patients' lives. A 10% increase in the number of nurses with a university degree could help 1 per thousand patients avoid death. 10% increase in the number of nurses with higher education could reduce the odds of failure to rescue by 5%. So what can hospitals and administrators do to foster nursing institutions? Hospitals need to display nursing-based awards within their facilities and on their websites, where it should be front and center. There also needs to be an explanation of why these awards are important to patients and to the public. Hospitals need to offer nursing-based care, like nursing clinics and patient seminars hosted by nurses. This nursing-based care should be easy for patients to locate on the web and in person. And hospitals need to encourage and cultivate their current nursing workforce in the form of continuing education courses, career advancement stipends for conferences and higher education, and teaching opportunities. By doing so, hospitals are investing back in what makes them elite institutions, the nurses. Finally, we want to guide you through a story involving you as a patient. Imagine you're entering the emergency department. You're experiencing severe pain across your left collarbone. You're short of breath, sweating, and feeling as if you will vomit any moment. You barely make it to the reception desk when someone runs up with a wheelchair and introduces themselves as the triage nurse. They wheel you back, all the while asking you questions. What's your name? Do you have allergies? How long have you been experiencing this pain? Did you take any medications today? Are you currently on any medications? Do you have any medical problems? Do you have any heart problems? The nurse places stickers all over your chest as they explain the EKG and why they think you need it. Another nurse arrives and places an IV, while another nurse is checking your blood pressure, your heart rate, your oxygen saturation. Within minutes of arriving, the nurse tells you you're having a heart attack, and teams of people descend upon you because the nurse called for them. because you need help right now. When you enter the emergency department, a nurse is the first clinician you see, and she or he has the knowledge and capability to not only care for you, but to save your life. And that is why hospitals are nursing institutions, because patients are not admitted unless they need nursing care. Thank you.